I am indeed grateful for the wonderful opportunity to be present for the official opening of the National Diabetes Food Care Symposium, which has been organized by Diabetes Fiji in partnership with the Ministry of Health and Medical Services. Foremost, I would like to thank Diabetes Fiji for its tremendous support and commitment in leading the outreach and awareness programs for diabetes prevention. It is not an easy task, and as such, a partnership such as this is vitally important for the Health Ministry in its effort to tackle the increasing cases of non-communicable diseases in Fiji. Mr. Dabish Akbar and your team, a big thank you for the great work, and we look forward to further strengthening partnership with Diabetes Fiji. Ladies and gentlemen, what I'm here to tell you is nothing new. We were together last year at the Novotel Lamy at the same symposium. We need to start asking ourselves, what have I done or can I do to make a difference in this major health crisis faced by our nation? What have I done last year to show that I have contributed positively for the cause of non-communicable diseases in my home, in my children's school, and most importantly, in our communities? We all know diabetes in itself is a major NCD, which accounts for the second highest rate of NCD-related deaths in Fiji. What am I doing? What can I do? According to the data collected by the Ministry's Health and Information Unit in 2015, a total of 669 amputations were carried out. Similarly, in 2016, a total of 791 amputations were recorded. The statistics further shows that the amputation rates increased from 12.1 to 12.6% from 2015 to 2016. Apart from the impact of amputation to physical well-being of a person, there are other psychosocial impacts such as depression and a drop in quality of health. Ladies and gentlemen, this is a clear indication that we need to put our heads together at forums as such and bring about a positive changes that calls for more proactive measures to be taken by those people living with diabetes, to take ownership of their health by being actively involved in choosing a healthy lifestyle on a daily basis, and to manage their health. Today, I am grateful to see the inclusion of nurses from the Pacific Islands countries. Health professionals play a central and critical role in improving access and quality health care in the populations. They provide essential services that promote health, prevent diseases, and deliver health care services to individuals, families, and communities. The Fijian government has seen the importance of having nursing specialization with the newly established position of food care around the nation to ensure the program is sustained and also allow more accessibility to all Fijians. One of the many government strategies also is to reduce the rate of NCDs and to increase the taxation of sugar-sweetened beverages, alcohol, tobacco, and reducing taxation on glucose testing machines. This is apart from ensuring that the essential medications are available through the free medicine program. Ladies and gentlemen, government cannot do this alone. We need your help to address this deadly disease, and our lifestyle habits need to change. There are bad habits that affect our health, which includes excessive alcohol intake, tobacco, and consuming too much processed foods. When one consumes lots of sugar, oil, and salt, it increases the risk of getting diseases like hypertension, cardiovascular diseases, and diabetes. NCD affects the productivity level and affects the quality of one's life. I encourage each of you here today that it is vitally important for everyone to work together to take responsibilities to address the issues of NCDs. In fact, the three leading causes of disability and deaths in Fiji are heart disease, diabetes, and stroke. Given that addressing diabetes is one of the key strategies to reduce NCD, This symposium is an opportunity to bridge the gap in care of diabetes. Every diabetic must be screened with comorbidity of diabetes to avoid that late presentation and further complications. Also, there is a need to improve knowledge of healthcare providers to better manage diabetic through enhanced information sharing and nurture the multi-sectoral partnerships through such symposiums. There is a great need to improve communication between primary and secondary care. There is also a need for improved collaboration between departments, particularly in collaborating resources and ideas to address issues that hinder the services, especially when patients need to be referred from one nursing station level to a health center and then to subdivisional hospitals before being referred to the divisional. Questions we probably need to ask ourselves: are necessary tests and examination being done to acquire right information before being referred to next level or surgical intervention done? When should the patient be transferred from divisional hospital to a subdivisional hospital? Are surgeons managing foot problems alone? Is there a need for holistic approach from medical, physios, rehab, family support unit, stress counselors? Who should be responsible when the patient is discharged, and how regular should they be reviewed? How efficient are we reviewing the cases to avoid the readmissions? And this is what I find that is also very important. Are the caregivers equipped well enough to manage their loved ones at home? Do they need training to better take care of their loved ones? Ladies and gentlemen, the increasing rates of amputations to diabetes is also a great concern. As such, the major strategy in preventing amputation is through early detection of abnormalities, education of clients, and empowering people living with diabetes to take more proactive approach to health and wellness. Inspection of the feet of every person living with diabetes and offering the correct advice should be a priority activity to our community to avoid unnecessary amputations. I look forward to learn about the outcome of your deliberation and the strategies that will enable us to find the best way forward in achieving our targets to reduce and efficiently reduce diabetes and NCDs in Fiji. On this note, I would like to once again convey my utmost appreciation to thank Diabetes Fiji and all the presenters who will be sharing their knowledge and expertise in this symposium. I also commend Diabetes Fiji for the achievements made in progressing the foot care project and its objectives. One of these is the decrease in the major amputation to minor amputation. Last but not the least, to all participants and facilitators here today, I encourage you all to maximize that opportunity. Take back with you all the information you need to better your work or the care you give. The famous physicist William Polar said, and I quote, "Information is a source of learning, but unless it is organized, processed, and available to the right people in a format for decision-making, it is a burden, not a benefit," unquote. With these words, I have the greatest pleasure in declaring the 2018 National Diabetes Foot Care Symposium open. Punaka.